This is breaking news.
Mayor de Blasio is giving an update on the coronavirus pandemic in New York City. Let's go to
it means for all of us. So here's the bottom line. As Dr. Choksi said yesterday, it's going to be a challenging few weeks. There's no question about it. We're seeing a big upsurge in cases. Thankfully, in general, they seem more mild, and thankfully, our healthcare system is well positioned in this city to deal with it. But it will be a tough few weeks, and we need to understand that, and we need to do everything possible to address that. But look, this is going to be a temporary reality, and I want to emphasize that. What we're seeing so far from Omicron is a very fast upsurge and then goes back down again. It's based on what we've seen in other parts of the world. We are preparing for that kind of very fast scenario. And that means we got to keep focused on the big picture, which is to keep this city moving forward. To remember, we got to keep building our recovery. We got to keep everyone safe. And the way to do that is vaccination. What unites all the strategies is vaccination. Vaccination is the way to protect ourselves against Omicron. Vaccination is the way to continue our recovery. Vaccination is the way for people to live their lives again. Vaccination equals freedom. So that's going to be our focus in all of our strategies. When it comes to vaccination, New York City is ready, and we need you to be ready too. We need you to do your part. Everyone who has not yet gotten vaccinated, it's time. Everyone who can get that booster, it's time. Everyone who has a young child not yet vaccinated, it's time. So this city is ready to make sure that everyone gets vaccinated, everyone gets that booster, and that's the way we move through these challenging few weeks. And the other important point is, adamantly, I feel this, no more shutdowns. We've been through them. They were devastating. We can't go through it again. In this case, we weathered the storm because we were prepared with a high level of vaccination already. We were prepared with a strong healthcare system. We're prepared to get through. We need to all work together now to get through these weeks, come out the other side, continue our recovery. But no shutdowns, because that would devastate the lives of so many New Yorkers. Okay, with that overview, here's the news of the day. First from Washington, good news, and very thankful to President Biden, who continues to come up with new approaches to help address COVID, continues to respond whenever New York City needs help. And I want to thank him for that. We've gotten word there will be additional federal testing sites in New York City. That's going to help. There's obviously a huge demand for testing. We're increasing the city sites to 112 sites, fixed sites and mobile sites by the end of this week. Federal government's coming in to help. They're going to be up and running in the next few days. That's extremely helpful and important. I've been talking to the president's COVID czar, Jeff Zients, who has been always responsive with his team, always responsive to New York City. We're trying to get a major new shipment of at-home tests as well. So we're going to hear from the president this afternoon with more details. But what we're hearing so far is going to be really helpful to get us through these next few weeks. Now, when it comes to what we're going to do here, well, let's again frame this. As we said at the start of this week, we now have over 6 million adult New Yorkers who have had already one dose at least. Over 6 million adults in the city have had one dose. That's amazing. Over 600,000 young people. That's fantastic. We need that number to go up more. But New York City's been leading the way with high levels of vaccination. It's made all the difference. It's made us strong and resilient compared to so many other places, but we got to double down. And one of the ways to double down is with boosters. Boosters are absolutely key at this moment. We need everyone to focus on boosters. If you're eligible, it's time. It will make all the difference. Now, we heard great news yesterday from Moderna that their booster increases the antibody levels that are necessary to fight Omicron. And that is crucial. We have more and more evidence of the impact boosters can have in fighting off Omicron. This is a crucial piece of the equation. So if you're vaccinated, that's great. But if you want that extra protection, go get that booster now. We want everyone right now, as quickly as possible, to get those boosters. And we're going to make it even better for you with a new incentive, and an incentive that is here just in time for the holidays, because every one of us knows we're out there shopping for our families. It would be nice to have a little extra cash. So as of today, we're announcing a $100 incentive for everyone who goes out and gets a booster here in New York City between now and the end of the year. So it's a limited time opportunity. over these next days. Get your booster shot, get a $100 incentive. It's going to make you feel a lot safer, a lot better that you got the booster, and you'll have some more cash in your pocket at the same time. That's going to be a good feeling, particularly this time of year. You can go to any of the city-run sites that provide vaccination, or you can go to our partner Somos clinics and practices as well. So that $100 incentive, you'll get that quickly. That is now, today, if you go and get your booster today, through December 31st. So again, limited time opportunity, but exactly the time we need New Yorkers to go out and get their booster. This will be by far the biggest booster incentive program in the United States of America, and I want to see New Yorkers respond. This is the moment. Come out in real big numbers, get those booster shots, and help make your family safer and help make this whole city safer. With more about why boosters matter and why they are so effective, I bring you the city's doctor, our health commissioner, Dr. Dave Choksi.
Thank you so much, Mr. Mayor. More than a month ago, I issued a commissioner's advisory calling on everyone to get a booster dose of COVID-19 vaccine when it was their time, and urging that providers not turn anyone away due to eligibility considerations. That was because even then, the science was clear about the benefits of booster doses. Since then, Omicron has made booster doses even more important and urgent. Yesterday, the CDC estimated that Omicron is now responsible for an approximate 93% of cases in the New York City region. But while the evidence is still emerging, thus far it indicates that an additional dose of Pfizer or Moderna provides enhanced protection against both infection as well as disease related to Omicron. Pfizer released preliminary laboratory data showing a 25-fold increase in protective antibodies after a third dose. And yesterday, as the mayor mentioned, Moderna released similar data showing a 37-fold increase. The way that we should think about this is that an additional dose helps keep your immunity up to date. Over 1.7 million booster doses have already been administered in New York City, and I thank each and every New Yorker who has stepped up to increase their own protection and reinforce our vaccination wall against this new wave. But we have more work to do, and we must do it quickly. That's why I'm grateful that the mayor announced the $100 incentive for booster shots across city sites. In total, over 1,000 sites are offering booster doses in New York City. Just visit nyc.gov/vaccine finder or call 877-VAX4NYC to get linked to one. Or we'll come to you. Just visit nyc.gov/home vaccine to schedule a booster dose at home. We can all play our part in this booster sprint. I know many New Yorkers will be spending time with their loved ones over the next few days, even if only virtually. Please urge them to get their booster dose, particularly if they're older or otherwise at higher risk. And a special note for those who received the J&J vaccine, I recommend a booster dose of either Moderna or Pfizer for anyone vaccinated with J&J at least 2 months ago. That means anytime before October 21st. So simply put, if you haven't yet gotten your booster dose, there is no better time than right now. Thank you, sir.
Thank you so much, Dr. Choksi. What a clear, powerful message. And listen, 1.7 million New Yorkers have gotten a booster already. That's amazing. That's going to help everyone to stay safe, but there's a lot more New Yorkers who can get that booster, and starting today, you get that $100 incentive with it. A great additional reason to come out, but really the most important reason is what Dr. Choksi just said, the impact of the boosters, so crucial. Now, I want you to hear from one of the national voices on the whole challenge of the COVID era, and he has been speaking about the different strategies and approaches that are needed, and particularly recognizing this moment with Omicron. I want you to hear from him about what it means to focus on boosters, to have incentives like this, the kind of mandates we put in place on top of that. He is a professor of molecular medicine and a cardiologist. He is the founder and director of the Scripps Research Translational Institute. someone who has really, really studied what we're going through and understands what we need to do to keep moving forward. My pleasure to introduce Dr. Eric Topol.
Thank you, Mayor de Blasio. I'm thrilled to join you, and I have to commend you for your efforts on this incentive program for boosters. It couldn't come at a more appropriate time when we're way behind in this country with the booster program. Unfortunately, we had all the data, as Dr. Chokshi reviewed, well before Omicron. In fact, we had the evidence of preventing death in all people over age 50 from Israel, from a very large study, by 90%. You don't see that very often, a 90% reduction in death. We also had another large study with reduction in hospitalizations or death in people over age 40 from the largest health system in Israel. We had a randomized trial of over 10,000 people with 3 shots of the Pfizer vaccine versus 2 shots and a placebo, and 95% reduction of symptomatic infections against all ages. The data were clear before Omicron appeared, right around Thanksgiving. Now, what's happened with Omicron is that we have diminished protection from vaccines. Even with a booster, it is reduced to 75% from 95%. But that's the key. Without a booster, it's only a 35% protection. So that jump from 35 to 75% is a really big one. It's a more than double a protection. That's why the boosters are so darn important. So the fact that you are promoting this with this new incentive campaign for the rest of the year is fantastic. The leadership you provided in New York City is exemplary for all of us in the country. The rapid tests that you've been distributing, annotating the announcement today from the president, the distribution of high-quality KN95 masks, which we can't have enough of, instead of just a plain cotton mask. These are the things that can protect us against Omicron. So thanks for your leadership in New York City. We can all learn a lot from you.
Well, Doctor, thank you so much. And you really laid it out beautifully how important it is for everyone to get that booster. Look, as we've seen throughout, vaccination is the key, but continuing to deepen the vaccination makes all the difference. And there's so many more people who would benefit from the booster. We hope this incentive inspires them further. And Doctor, thank you for your leadership, your strong voice, as we find the strategies that work to fight our way through the COVID era. Thank you very, very much. Now, everyone, remember, to get that incentive, you can go to any of the city-run vaccination sites. And again, the sites run by our partners, Somos, at their clinics and practices. So all of those sites available where you can get the booster and get the $100 incentive. But I also want you to know there's another great option, which is at-home vaccination. This is something we've made available for months and months. It's reached hundreds of thousands of New Yorkers really, really effectively. And any city resident who wants at-home vaccination, it can be scheduled. A vaccination team comes to you. By the way, they can provide vaccination for the whole family. Many people has want it, whether people need a first dose, a second dose, or a booster, or if different people in the family are at different points in their vaccine trajectory. The teams that come to your home have the ability to provide whatever help you need. And the $100 incentive is available for every family member. That's crucial to remember, too. So if that's a better option for you, you can get at-home vaccination and get the incentive for everyone who needs a vaccination. You can go to nyc.gov/home vaccine, nyc.gov/home vaccine, to take advantage of that opportunity. And everyone, look, I'll just finish with this point. It's the holidays. We want to protect each other. We want to get together with our loved ones, do it in a safe way. We all know the smart things to do because we've been through this now for 2 years. But the #1 way to keep everyone safe is to get vaccinated. So if you haven't gotten that booster shot, go out right now and do it. It makes a big difference. Go get it right away. Get that $100 incentive. All right. Now, I have the opportunity today to honor someone who really epitomizes the resiliency of New York City, the strength of New York City, the spirit of New York City. This is a time, given everything we've been through these last 2 years, I like celebrating our heroes. I like celebrating the folks who are quintessential New Yorkers. I like to remind us of who we are and how strong we are because of everything we're going through and we continue to go through. But I have no doubt of where we're going because New York City always finds our way through. And a lot of times we get stronger. Even though we don't wish for any crisis like this, a lot of times we get stronger in the process. So he recently did an extraordinarily powerful documentary called New York City Epicenters and looked at everything we've been through with COVID and before that with the tragedy in 9/11. And his voice is one of the truest voices of all New Yorkers. The way he understands our city, loves our city, sees into our neighborhoods and our lives. And I have to say, as a Brooklynite, I'm particularly proud and just moved by the way he's portrayed Brooklyn over the years and the love he shows in his portrayals. And he shows the tough realities we face, too, with a really clear eye. And that has been moving to a lot of us and inspiring to so many of us. So he's won every award there is, so I don't need to list all of them. He's someone who has shown incredible loyalty to this city and love for this city, so much so that regardless of what's happening, he remains a Knicks fan through thick and thin. And I admire, that is persistence, let me tell you. Thick and thin. I think there's been a lot of thin, but he's still the most energetic of fans. I could go on all day about all he's done, but I want to take a break from what I have to say to turn to someone who loves him, loves his work, has for years said to me that he portrays the culture of the city and this nation in a way that almost has never been achieved by anyone else in film or any other medium. And Charlene McRae and I, when we started dating, one of the first things we did was we went to a Spike Lee film. So we feel deeply what this man has done for all of us. And let me turn for her comments to the First Lady of New York City, Charlene McRae.
Thank you, Bill. And hello, everyone. This is a good day. It's very rare an artist comes around who can shake an entire system to its core. An artist with a conscience who interprets our world and reflects it back to us. An artist who just doesn't open a door, but kicks it down, making a path for others. Spike, thank you for telling stories about Brooklyn, our Black and brown people, our city, like no one else dared to. Thank you for challenging the status quo. Thank you for using your talent to say what needed to be said when no one else would do it. I can't think of anyone who captures the culture like you. You have it all down. The hustle and the charm, the rush and the drive, and the word dances people speak. You put it all on screen. The fast beating heart that is our city, you show it with raw truth-telling and compassion. No one does it like you, Spike. You got game. Congratulations. You earned that key to the city.
Beautifully done. Charlene, you outdid yourself. You can see the poet coming out there.
Yeah.
You know? So everyone, we're going to hear from him, but I just want to say, giving out the key to the city is a profound honor. And many great people have won this honor over the years because they did extraordinary things. But I can safely say no one has portrayed our city more truly, more from the heart, in a way that both demands better of us and tells us how good we are in our souls. No one's done it better than Spike Lee. So it is my profound honor on behalf of all New Yorkers to present the key to the city to Spike Lee.
Thank you.
Yeah, it unlocks everything. The floor is yours.
Well, I want to thank you for this honor. Thank you for the lovely words from your lovely wife. And it's very simple. I love New York City. I was born in Atlanta, Georgia, but moved to Brooklyn, New York when I was 2 years old. Went to PS 29 in Cobble Hill, PS 8 in Brooklyn Heights, PS 7, Farragut Projects, junior high school 294, used to be called Rothschild, and then I went to high school, Coney Island, John Dewey High School. So I'm a product of the New York City public education, and it shaped me. You know, I live and die New York City, the greatest city in the world, and the greatest city is going to have great problems, but we overcome, which is something we, as you mentioned, Mayor, the last documentary, NYC Epicenters, where we took 8 hours to really dig in 9/11, and also this virus is still with us. And there's one segment of the series where we have show a list of all the calamities. I mean, going back to the Revolutionary War, World War II, Hitler, Hirito, they were trying to bomb New York City. Come with the type of plane bomb. I mean, no matter what it is, we come out on top because we're New Yorkers. That's how we're built. Other people are gonna hate, let them hate. But we know what the deal is. You know, we're the greatest city in the world, and when you're up there, people take shots at you. And we just move and duck and you know, and moving forward. So again, you know, and I was really, thank you for saying what you were saying before about people. We have to get vaccinated. We gotta get booster shots. I mean, this is not the okey doke or the rinky. It is, we know 800,000 Americans have died. They're no longer here. So let's get on the good foot, like James Brown, like the God by the Soul said. Let's get on the good foot. Let's get that boosters. Let's get those shots, and let's go. Let's go.
Spike, I want to ask you three things.
Yes. Let's leave the Knicks out of it.
No. You're not going to get left out. That would not be fair to New Yorkers. Let's start big picture.
Yes.
And I know you've spoken about this before. So you know, in the beginning of COVID, a lot of people said this was the death knell for New York City. Mm-hmm. A lot of people left, and they said New York City never come back.
You had the shovels, getting ready to bury us.
What do you say to the doubting Thomases about New York City's future?
Can I use a Italian American gesture?
Whatever you do, we're gonna look the other way.
No.
That was very accurate.
I grew up in Cobble Hill. My family was the first black family in Cobble Hill. Cobble Hill was predominantly Italian American because the docks are right there.
Yeah.
People bought homes so they could work on the dock. So
you come by it natural.
Well, I mean, if you look at it, look at the content of Do the Right Thing, Jungle Fever, even Summer Sam. So, I mean, a lot of my friends today, the kids, the people I grew up with when I moved into Cobble Hill, we're talking about 1963.
I love it. I love it. So what do you say about the future of New York City?
We gotta keep doing what we're doing. How old is the city now?
It's almost 400 years now.
There you go. Keep doing what we've been doing for 400 years. I mean, look, there's things that we have to address, and you know, you pass the baton to brother man, but for me, education, affordable housing. You know, if the black and brown communities aren't able to afford to stay in this, it's not going to be New York City. You know, so it's not going to have flavor. And that's what we are. You know, it's the mix, the gumbo of everybody coming here. And it's going to be tough, but you know, we've done it before. So
We've done it before.
onward and upward. That's what I have to say. Onward and upward.
I like that. Now, arts, culture, film, TV, they're coming back. Tell me, what do we bring? Why do people keep coming here?
Well, a lot, you know, driving here. I heard about, you know, a lot of these Broadway shows are closed, and so we really can't get back to our true, the king of culture, till we get rid of this, you know, this virus, you know, because if artists can't perform in front of New Yorkers or the people who come from out of town, then culture is our DNA.
Amen.
And this virus, you know, first with the Rona and now the Omicron, you know, it shuts things down. And a lot of young artists who came from afar had to leave New York and go home because stuff was shut down.
But we can be the king again.
Oh, no doubt. I mean, it's not LA. Even though that's what you could say the film and TV industry, you know, that's where the studios are and the streamers. But we're always going to be numero uno. That's a fact.
I love that. All right, here's your last question. I'm sorry, controversy is going to visit you. Okay, what are we going to do with the Knicks? What do you want? What do you want to see from the Knicks? What do you want to change about the Knicks?
Well, I think that we're with Leon Rose, Worldwide West. We put the pieces together, and we just got to keep going. You know, I was at one of my greatest days ever. May 8th, 1970. Game 7.
The golden age.
I was at that game.
Wow.
Where the Knicks won their first world championship. I was 13 years old. My father's lawyer had season tickets. Back then, the yellow seats. And Peter Eichenberg, that's his name. He said, Spike, there's a game 7. You could go with me. And that's the Willis Reed game.
Amazing. He limps on the court.
Yes, but people forget this. When Willis Reed walked onto the court, that's the loudest I ever heard Masquerade. I've been to a lot of games. This is 1970, and we were playing the Lakers. Game 7, the Lakers had Wilt Chamberlain, Elgin Baylor, and the local, Jerry West. And Willis came out. When Willis limped out, both teams were going through their warm-ups, layups. The entire Laker team stopped and turned around and saw Willis limp on the court, and the game was won.
I love that.
Walt Frazier had like 36 points. 18 is, it was crazy. And so, to answer your question, back then the Nets were in New Jersey or somewhere, I don't know. So when it comes to, I'm not, you know, my casket might be orange and blue. There's going to be some orange and blue somehow in the casket. So that's my team. Look, I have no hate on the Brooklyn Nets. The Barclays Center is 4 blocks from the world headquarters of 48 Guns and a Mule. Love, you know, Harden, KD, and Kyrie, you know, I got love for them, but, you know, they're not my team. Simple as that. No hate, all love, but the Knicks are my team.
I love the poetry with which you speak, including, I think there's a metaphor in there that Willis Reed walked on the court and the game was won. The game was won right there. That's got something, we got to remember that in this moment.
Yes.
It's all about heart and soul, right?
Willis displayed it that night. I mean, look again. I'm on the clock. What are we doing? We good?
You got another minute. Go ahead.
I need more than a minute.
Okay. You got the key to say you can do whatever you want at this point.
Give me these 5 minutes, less than 5. Let's understand. The Knicks, this is my team. Willis Reed, Walt Frazier, Dick Barnett, Earl the Pearl Monroe, Senator Bill Bradley, Dave DeBusschere, Cassie Russell, Dave Stallworth, Coach Red Holzman. This is one of the greatest teams ever. This is a team I grew up with. And moving forward, Patrick Ewing, Starks, Oakley, you know, Anthony Mason, you know, I mean, those are my guys. It's been lean. We haven't won since the 72-73 season, but God, one day, before I take my last breath, there will be another banner hanging from the world's most famous arena.
I love it.
The Garden. I love it.
There's your incantation. There's your benediction. It's being felt.
Let's hope so. Orange and blue skies.
Amen. Spike, you are truly a treasure.
Thank you very much.
And the ultimate New Yorker. God bless you.
Brooklyn's in the house. Brooklyn's in the house.
Brooklyn, baby.
Yeah.
Brooklyn. Brooklyn. Thank you, Spike.
No disrespect to other boroughs.
Oh, that was good. See, he got diplomatic there. It's good to see you have a diplomatic side, too.
Oh,
that was good.
Yes.
All right. Everyone, you just heard just beautiful, powerful, from the heart. Spike, thank you. Thank you for all you do for all of us and all you do for this city you love.
I love New York. I love New York. I love the people. We're special. It's not easy. Living here is not easy, but the people that hang.
That's it. That's the perfect way to describe us. Everyone, thank you. Thank you, Spike. And everyone, when I hear Spike talk, I just get reminded of our strength. I really do. And how we see our way through. All right, so now we're going to go back to talking about how we fight off COVID and move through. Thank you, Spike.
Thank you.
Very, very Merry Christmas, Happy Holidays. Beautiful. Oh, look at this. There we go. We're going to do a little. That's cool. It's signed even. Okay. Thank you, brother.
You would have missed it.
All right. Merry Christmas, brother. Okay, every day we go over our indicators. Let's do it again today. And again, number one, this is the key, vaccination. And this number keeps climbing. We need to climb more. So, doses administered to date, 12,988,773. That number is going to hit 13 million very soon and then keep going. But now we start to see the numbers that tell us just how fast moving Omicron is and what an impact it's making. Number two, daily number of people admitted to New York City hospitals for suspected COVID-19 today, 200 patients as of today. Confirmed positivity, 50.24%. Hospitalization rate per 100,000 New Yorkers is now 1.93. So these numbers have moved a lot. Again, our hospitals are doing very, very well addressing it, but this is going to be an intense few weeks. We got to get ready for that. And then number three, new reported cases on a 7-day average. And this is really striking. The case numbers have jumped up, obviously, 9,297 cases, and that will continue to rise over the next few weeks. We are going to have to get ready for that in a lot of ways, but the most important thing, the reason New York City is ready, is the high level of vaccination already. We got to double down on that. Okay, I'm going to do a few words in Spanish, and this is on the incentives for the booster. La ciudad de Nueva York está liderando el camino de las vacunas. Comenzando hoy, cualquier persona que reciba un refuerzo recibirá $100. El refuerzo lo ayudará a usted y a los demás a mantenerse a salvo. With that, let's turn to our colleagues in the media. And please let me know the name and outlet of each journalist.
Good morning. We will now begin our Q&A. As a reminder, we are joined by Health Commissioner Dr. Dave Choksi, Dr. Ted Long, Executive Director of the New York City Test and Trace Corps, and Dr. Mitch Katz, President and CEO of New York City Health and Hospitals. Our first question for today goes to Andrea Klein-Thomas from CBS.
Good morning, everybody, and happy holidays.
Happy holidays. How you doing, Andrea?
I'm great, thank you. Mr. Mayor, your vaccine mandate for city employees in October required proof of at least one dose of the shot. Has your administration followed up to ensure that city workers are now fully vaccinated? And will you issue a booster mandate or urge Mayor-elect Adams to do so in light of the Omicron variant?
Yeah, Andrea, thank you very much for the question. And I'll turn to Dr. Katz so you can speak about the experience with his agency, with Health and Hospitals, in terms of that follow-up to make sure people get that second dose. The answer there is decidedly yes. The idea was get that first dose immediately if you hadn't gotten it, but then there is a stipulated timeline to make sure you get your second dose when you're under one of those mandates. And to the other part of your question, we're certainly looking at the question of adding boosters. We're in discussion on that. We'll be in discussion certainly as well with the mayor-elect and his team. We don't have a decision on that yet, but we'll have more to say in the days ahead. But as to how we make sure that under current mandate, people get not just the first, but the second dose, Dr. Katz, why don't you describe the experience you've had?
Yes, sir. We track with everyone when they get their first dose, when their second dose is due. We remind them. And just as people were required to get the first dose, they are required to get the second dose. And if people do not get that second dose, we do require that they stop coming to work until they get that second dose. So we're very tight on that. We feel very strongly that once people are due for the second dose, they have to get it. I will say, sir, that it's much easier. We have not had much issue with people getting the second dose. People have needed reminders, but we have not had any experiences of people who absolutely felt they couldn't get a second dose once they had already gotten a first dose. Thank you, sir.
Thank you. Go ahead, Andrea.
What about this $100 booster incentive? How much money do you have to spend for this initiative, and where is it coming from? Does it affect any other programs?
No, Andrea, it does not affect other programs. Obviously, everything when it comes to fighting COVID is a budget reality and a budget necessity. We make it the priority in terms of where we spend the people's money to fight COVID first, because that opens up the door to recovery and everything else. So it will not affect any other initiative. This is a limited time, but we hope a lot of people take it up because it will be money well spent. So we're talking about from today through December 31st, and we will simply make it a priority to spend whatever it takes. We need to get the folks to get these boosters. That will be the difference maker.
Our next question goes to Andrew Siff from NBC.
Hi, good morning. Can you guys hear me?
Yes, Andrew, how you doing today?
Good. I wanted to start with a question about schools. We are hearing from principals, parents, and others that they're not getting clear answers from the Situation Room about a growing number of COVID positives in the schools, and many describe it as a confusing reality. They don't know if any individual schools close anymore, if there's a hesitancy on the part of the city to close a school, even if there are dozens of positives there. Can you clarify what's happening with the Situation Room and what's happening with schools right now?
Absolutely. We have doubled the staffing of the Situation Room. We're applying the rules we've had over the last few months consistently. We have 4 schools that are closed out of 1,600. We have hundreds of classrooms closed, but that's out of 48,000 classrooms. We definitely see an uptick in terms of cases, but again, against a backdrop of a school system that has the highest conceivable level of vaccination in terms of the adults, and a huge number of health and safety measures. So the school system, the amount of COVID in the schools is about 1/5 the amount you're seeing in the rest of the city. We've got today, tomorrow, Thursday, and then of course there's the winter break. So things are moving. I'm going to turn to Dr. Choksi, who's spent a lot of time working on the connection to schools and making sure that the policies we have used really keep schools safe. And he can speak to what we're seeing overall in the schools right now. Go ahead, Dr. Choksi.
Thank you very much. And sir, I would just add briefly, we are seeing cases increase across the city, as you know. We're seeing community spread, and that does affect what we're seeing in our schools as well. But remember, this is why we put all of those layers of safety precautions in place in our schools. The levels of vaccination, masking, distancing where it's possible, testing, all of these things work in concert to make schools among the safest places where kids and staff can be. We do bring to bear our tools around quarantine and, when necessary, school closures when we are seeing evidence of transmission occurring in schools. And because cases are higher, we have seen an increase in using those mechanisms as well. Although, as the mayor has pointed out, the vast majority of classrooms and the vast majority of schools remain open so that our kids can benefit from the in-person learning that provides. The last thing that I'll say is just to reemphasize, there's one really important thing that parents can do, particularly if you have a child who's 5 to 11 years old, and that's to get them vaccinated. We do need to get those vaccination rates up because that will help both for the near term as well as the longer term. Thank you, sir.
Thank you. And Andrew, just before your second question, just an update. I had the number at the end of yesterday. As of this morning, it's actually 7 schools closed out of the 1,600. 7 schools, just to clarify that. Go ahead, Andrew.
Yes, the question on the federal testing site, and you indicated we're going to be getting details on this later today. Wherever it is, the Javits Center, whatever mass site, I wonder, what do you envision as to how effective that can be, given that people have developed a pattern of going to get tested in their own neighborhood or near where they work? And do you think it's too late in terms of Christmas being just days away?
Oh, it's not too late at all, because it's not just about Christmas, obviously. It's about these next few weeks and as best as possible getting ahead of it. No, it's value add for sure. We want as many sites as we can get. I agree with you that with testing, like with vaccination, the best efforts are done at the neighborhood level, at the grassroots. That's how we reoriented everything to decentralize. Originally, you'll remember the state had a lot of mega sites. We found people were not using those enough. We went to a different approach, really grassroots and decentralized. But given the high demand for testing, unprecedented because of Omicron, more sites are better. And if folks are finding lines somewhere and they see another site where there aren't lines, they'll gravitate to the new site. So I'm very happy the federal government is doing this, because more is more in this case.
Our next question goes to Emma Graves Fitzsimmons from the New York Times.
Hi, good morning, Mayor. I wanted to ask about holiday travel. So Dr. Choksi said that he canceled his holiday travel plans. Dr. Varma said on Twitter he was canceling his trip to the West Coast. I unfortunately canceled my trip to Texas with my family. We all have young children who cannot be vaccinated or high-risk relatives. Are you advising people not to travel out of town for Christmas?
I'll turn to Dr. Choksi and first say I'm sorry for you and your family, Emma, that you couldn't take the trip, and especially painful because so many people have been waiting for so long to see their loved ones. The first thing I want to say, I'm the layman and Dr. Choksi will be the expert, but I want to speak to my fellow New Yorkers about think about those who are most vulnerable in your family. I think that's the best way to think about it. If you've got folks you're going to see, or folks who are traveling who are in those particularly vulnerable categories, oldest New Yorkers or folks with serious pre-existing conditions. Obviously, the most important thing is to keep them safe. If you're traveling with folks who are less vulnerable, that's a different reality. And as you said, if folks who can get vaccinated versus can't get vaccinated, whether people have gotten that booster, there's a lot of factors. So I don't think it's one size fits all. I do think it's, proceed with caution and think about the people most vulnerable in your life. And Dr. Choksi, now you can be the real expert.
Thank you, sir. And I agree as well. And first, Emma, I'm also sorry to hear about it. I know many people have had plans upended. I hope you and your family still enjoy a wonderful holiday season locally. Well, look, these are my recommendations. I have a very clear and strong recommendation. If you are unvaccinated, you should not travel. That's for your safety as well as the safety of others whom you will be in contact with. On the other end of the spectrum, if you are fully vaccinated and you have your booster dose and you are not in one of the high-risk categories, then it is safe to travel if you take precautions, meaning wearing a mask at all times during your travel. You can consider using a higher quality mask as you're doing so. And of course, the common sense precautions like washing your hands and taking other steps to protect yourself. It's the in-between category where, as the mayor said, people do have to calibrate their individual risk. And the most important consideration is the vulnerability either of yourself or the family members that you're traveling with. And I do advise caution if there's a borderline case. If you have any question and it is optional, then I would consider avoiding it at least for the next few weeks. Thank you.
Thank you. Go ahead, Emma.
I also wanted to ask about your legacy on the budget. So the budget has grown to $100 billion during your tenure and the highest workforce ever. The New York Post said that you were leaving Eric Adams a fiscal nightmare, including programs like 3K that won't have funding in a few years. So how do you sort of view your budget legacy?
I think when we talk about pre-K and 3K, for example, these were absolutely necessary for the children and families of this city and for our future. If we didn't focus on early childhood education, we were going to, in so many ways, deprive our children, and we weren't going to address income inequality if we didn't do those things. So I came here to address income inequality. I came here to change the lives of families. We had to do that. And you know what happens in the future is if something's truly a priority, then that's where the first resources go, and that's what needs to happen. The fact that the City of New York, before our administration, was not spending resources on early childhood education was absolutely missing the mark. So a lot of the changes we've made will become the highest priorities in the budget. Second of all, what we've done over these last 8 years, and obviously hugely disrupted by a global pandemic, but the whole idea was to build a stronger city in every sense, a stronger social fabric, a more fair and equal city, but also a stronger economy. You know, in the time I was mayor up to the pandemic, we added 500,000 jobs. That also brought in a huge amount of revenue. We made this a more diverse economy, strengthening tech, strengthening life sciences. We're going to continue to do that in the future based on what we've started. That's going to help bring in the revenue to make these initiatives sustainable. So I feel that we're handing off to Eric Adams exactly the kinds of approaches that are needed for the city of the future.
Our next question goes to Elizabeth Kim from Gothamist.
Good morning, Mr. Mayor. I wanted to go back to something Dr. Katz said about how H&H is following up with its employees on whether they're getting that second dose, and that if those employees don't get the second dose, they're asked not to report to work. I'm wondering if the same level of due diligence is being done by the DOE.
Yeah, Elizabeth, this is something that's been across, thank you for the question, it's been across all our agencies, that the mandate was clearly from the beginning to get everyone fully vaccinated. And that started with getting that first dose. And obviously, in terms of getting people to the first dose, it was wildly successful because 94% of the city workforce is now vaccinated. But we knew from the beginning that overwhelmingly anyone who got a first dose came back for a second dose anyway, even if they didn't have a mandate. When it's a mandate, we obviously have a further tool to ensure they do. So systematically across all our agencies, the instruction has been when someone gets to that point where they can get a second dose, it's time to remind them, put a time frame to it in which they have to get it. If they don't get it, then remind them that there is the risk of a sanction, and we're seeing people getting those second doses. That's the bottom line. Go ahead, Elizabeth.
My second question is about at-home or self-administered tests. If my memory is correct, I remember that, at the beginning of the school year, around September, you and your health officials had kind of teased some potential news on at-home testing. And then later on, I asked, whatever happened to that news on at-home testing? And if I remember correctly, Dr. Choksi said that they had been thinking about it, but they were uncomfortable with the fact that the city was using PCR testing in the schools, and then to introduce this other different antigen test, it would be apples to oranges. I'm wondering, given the fact that, it seems like we're moving toward self-administered tests, whether the thinking on that is going to change after the holidays. And I'm wondering if the at-home tests also get around the low opt-in rates at some schools for testing.
Well, really interesting question, Elizabeth, and thank you. And, I will say the reality over time has been, one, trying to make sure that the testing we had was available, first and foremost, and trying to have a consistent approach. And so, clearly at times we've had supply issues around at-home tests, among other challenges. But I think where you're going with your question is important. I'll turn to Dr. Choksi, that, we want to provide the options that are going to work and that people want to use, obviously. And when there's lines, the most obvious example in the world, when there's a line, that's discouraging to people. If you can give them an at-home test, that's encouraging to get them to do it. If an at-home test empowers parents to get more information about how their kid is doing, that's good for everyone. So I think over time we've seen this can be a great tool to use, but the challenge still is having a reliable supply. And that's been obviously an issue in these last days, that we don't have yet the kind of supply we ideally want to have. Dr. Choksi, you want to speak to the overall picture with at-home tests?
Yes, sir. Thank you so much. And the most important point is the one that you made, which is that with an increase in supply, there are more avenues available for us to use those rapid at-home antigen tests. And we want to bring those to bear immediately, given the unprecedented demand that we're seeing for testing. With respect to your thoughtful questions, Elizabeth, I did want to distinguish between two parts of at-home testing. The first is we have at-home PCR testing, which, thanks to Test and Trace and Dr. Long, we do already offer to close contacts, and that includes students who are close contacts. So that has already happened over the last several months. But the other part of it is what we were talking about, which is at-home, or sometimes called rapid antigen tests, which we also do want to expand the use of. But there are many different categories of that expanded use, of which schools will be an important one, which again, when the supply increases, we expect to deploy more and more. Thank you.
Thank you.